I want you to think about a world where death lurked in every glass of water. It's the 1800s, and a terrifying disease is about to sweep through cities across the globe, killing millions in its wake. This isn't some far-fetched horror story. It's the all-too-real tale of cholera, the invisible killer that would go on to shape modern public health as we know it. So, where did this microscopic menace come from? Cholera had been brewing in India's Ganges Delta for centuries, but it was about to make its grand and terrifying debut on the world stage. The Delta was teeming with life, both human and bacterial. It was, well, the perfect breeding ground for a killer that would soon travel far beyond its watery birthplace. But cholera wasn't content to stay put. As trade routes expanded and the world grew more connected, this tiny bacteria hitched a ride on ships, in contaminated water barrels, and even in the guts of unsuspecting travelers. It was the unwanted stowaway on humanity's journey towards globalization. Pretty sneaky, huh? As cholera set sail for new shores, it found the perfect accomplices: colonization and commerce. These twin forces of the 19th century unknowingly spread death and panic across continents. Consider this scene: a ship docks in London, its crew unaware they're carrying a deadly passenger. Within days, the city's slums become a battleground against an invisible enemy. And it didn't stop there. From Europe to the Americas, cholera cut a deadly swath through populations with terrifying speed. You're probably wondering just how fast this disease could strike. Well, it was like this. One day you're perfectly healthy, the next you're fighting for your life, and within 72 hours, game over. That's how cholera earned its nickname, the Blue Death. Scary stuff, right? Now, let's talk about the lovely living conditions of the 1800s, and by lovely, I mean absolutely disgusting. Stepping out your front door meant walking into streets flowing with open sewers. The air thick with the stench of human waste. Yeah, not exactly the good old days, right? In these 19th century cities, disease was as common as poverty, and cholera, well, it thrived wherever clean water was just a pipe dream. And that wasn't all. These cities were packed tighter than a can of sardines. Families crammed into tiny dark rooms, sharing space with rats and other less than hygienic roommates. Now, add in a complete lack of understanding about germs and disease transmission, and you've got yourself a recipe for disaster. It's like these cities were rolling out the red carpet for cholera. Enter our hero, Dr. Jon Snow. No, not the brooding Game of Thrones character. This Snow was about to save a lot more lives. Think of a man obsessed with solving a deadly puzzle, poring over maps, and interviewing locals. It's London, 1854, and Snow is about to make a breakthrough that will change medical history forever. But here's the kicker. Nobody believed him at first. You see, back then, people thought diseases like cholera were spread through bad air or miasma. Snow had a different idea. He suspected it had something to do with water. Crazy, right? Well, sometimes it takes a bit of crazy to change the world. And boy, was Snow about to turn things upside down. So let's zoom in on the infamous Broad Street pump. This unassuming water source was about to become the smoking gun in Snow's investigation. It was like a detective thriller, but instead of a murderer, we're hunting for microscopic killers. Snow started mapping out cholera cases, and guess what? They all clustered around this one pump like moths to a flame. Here's where it gets good. Snow convinced the local council to remove the pump handle. It was like cutting off the head of a snake. Suddenly, new cholera cases in the area plummeted. Boom! Snow had just proven that water, not air, was the culprit. This moment, it marked the birth of modern epidemiology. Not too shabby for a guy armed with just a map and a hunch, huh? So, what did all this death and discovery lead to? Well, it forced governments to finally get their act together. City planners and engineers were scrambling to redesign entire cities. We're talking massive sewer systems, water treatment plants, and public health laws that actually, protected public health. As we wrap up our journey through this dark chapter of history, let's take a moment to appreciate how far we've come. Cholera's legacy is written in the streets we walk today, cleaner, safer, and built on the lessons of a global killer. Next time you turn on your tap and clean water flows out, remember, it's a luxury bought with the lives of millions in the past. Pretty mind-blowing when you think about it, isn't it? So there you have it, the story of how a microscopic menace changed the course of human history, from the slums of 19th century London to the water systems we rely on today. Cholera's impact is everywhere. Remember, folks, history teaches and science saves. Now, if you'll excuse me, I'm going to go appreciate my indoor plumbing and maybe wash my hands a few extra times.